Hi, Emily.
Good morning.
Thank you for joining me today to talk about medical interpretation. Students, I'm doing this for you, and Emily is an instructor here at CBC in medical interpretation, Spanish medical interpretation.
Mhm.
So I'm delighted that you can answer some questions, give us some information that may provide practical tips for the students that I have in Communication 320 Health Communication. So welcome.
Thank you so much.
Could you first give us a little bit of information about yourself, how you got into this field and so forth?
Yes. I have been a Spanish medical interpreter for about 15 years.
Wow.
Um, Spanish is not one of my home languages. I learned Spanish in school, and I had the opportunity to live in El Salvador over several years. And so that really solidified my Spanish, my ability to really communicate in that language and understand that language and that culture. And when I had the opportunity to study a minor in Spanish medical interpreting when I was getting my undergrad degree, I just fell in love with the career. I love that it's very immediate. You're very present. You really have one job. Every healthcare provider is doing three things at once, but the interpreter is only doing one thing. And I just love that about the job.
Okay.
So I've been doing that ever since, and I've worked in probably every field. I've worked on video, I've worked in
Wow.
hospitals as a freelancer. So I've done a little bit of everything.
Fantastic. And now we have a certificate program at CBC that allows our students to get a certificate and be trained in what I have found is a more complicated field than I thought.
It is complicated. We have right now a 30 credit program, which you can take over 2 years or over 1 year, depending how many credits you want to take. And it gets you ready for national certification. So there's a national exam that interpreters now have to take in order to
Okay,
become certified in Washington and nationally as a healthcare interpreter. So our
that's
program gets you ready for that test.
we are so lucky. And in doing some research for this, I discovered just how many Americans we have who need interpretation. And the majority are Spanish, but of course we have all the other languages. And we live in such a diverse world, but a diverse community here in the Tri-Cities. Some of my students are elsewhere in the Seattle area and so forth, but everywhere we have a diverse population, and that makes it even more complicated, but wonderful to have this kind of service. So,
Yes.
can you tell us a little bit about the process of preparation that a medical interpreter goes through? How much do they know ahead of time as to what they're getting into, for instance?
Um, Usually not a lot. We know where our appointment is going to be generally. So if I'm going to an appointment at an endocrine clinic, at a primary care clinic, if I'm going to a same-day surgery center, that will give me a little hint about what topics I might need to know. When I was a new interpreter, I would kind of cram right before the appointment, I'd go back to my terminology list, make sure I remember how to say, if it was going to be a diabetes appointment, do I remember how to say your glucose meter, the test strips, your blood sugar.
Right,
Yeah, I'd like refresh all those terms right beforehand, although you never know for sure what's going to come up.
right.
And of course, now that I've been an interpreter for many years, I don't have to do that kind of cramming anymore. But the terminology is a big piece of what we have to learn when we're new interpreters.
Well, and there are so many specialty fields now.
Mhm.
And so I can see where sometimes there might be vocabulary that an interpreter doesn't know. What
Mhm.
happens in a case like this? And by the way, I've asked my students to formulate some questions. So when I bring up these things, it's usually because my students want to know.
Mhm.
But what happens when an interpreter is a little unsure about the terminology just because of the specialty situation?
Yes. The main thing is that we ask and we ask transparently. So we make sure everybody in the room knows. If the doctor said a term and I didn't know what it is, I'm going to say, just a moment, interpreter needs to clarify this term. And I'm going to say that in Spanish as well. So the patient knows what the doctor and I are chatting about.
Right.
And I might ask the doctor, can you explain that in simple terms? Is there another way you can say that?
Yes.
So, for example, if he's saying the patient has scleritis, and I'm like, I don't know what scleritis is. I don't know how to say that in Spanish. He'd say, oh, it's, an inflammation of the white part of your eye.
That
And then
makes
I can interpret that explanation.
that makes sense. Yeah.
Hmm.
What happens uh, when a patient doesn't want, for whatever reason, doesn't want the doctor to know some of his or her or their medical history? I mean, they're trying to get information that is important, and the confidentiality, continuum has to be a little rocky sometimes in trying to figure out what the needs of the patient are, what their emotional state is, how comfortable they are with the situation.
Hmm.
How does an interpreter handle that? Like, and I'm not sure I'm really asking that in the right way. I hope you've picked up on something that you can.
Yeah. Well, there's kind of two parts to that question. And the first is their trust in our confidentiality as the interpreter. So one of the things we do every time we go to a new appointment is we do a little like professional introduction. We call it a pre-session where we say,
Okay,
I'm Emily, I'm your interpreter today. My job is to interpret everything you say. I will
okay,
keep everything confidential and you can talk right to the doctor. I'll interpret exactly what you say as you say it. And I just give them a little sort of, a little snapshot of how I work, that I'm confidential. I'm really here to interpret every single thing. If you don't want someone to know it, don't say it because if you say it, I
oh,
interpret it,
okay.
right?
Oh, good
But
point.
the second part of that question is that sometimes different cultures have different communication styles. And
Yeah.
sometimes the doctors, they want a direct question. Do you have this? Yes or no? And they'll ask, do you have this? And the patient, instead of saying yes or no, will give a story or say something different. So really, we're just there to be the person's voice. So if they give an indirect answer, I interpret that indirect answer. And if the doctor wants to clarify, wants to ask again, wants to be direct, do you have this? Yes or no? That's the doctor's job to ask again. We're really there to be people's voices. But they're in charge of kind of how they want to communicate.
Right. And
Hmm.
that really does exemplify the complications that, challenges, I should say,
Yes.
challenges that come up. One student, and let me read this, said, I've had to translate before when our interpreters are busy. And for me, it is hard to translate when patients start saying rude things in
Mm.
Spanish, and I have to translate it in English to the provider. I try to sugarcoat it, but sometimes I don't want to repeat it or can't find the words to make it sound a
Yes.
what? Because as you were talking, I was thinking, time is so precious in these settings now, and sometimes that process can really expand the time needed,
Hmm.
back and
Certainly.
forth. And in this case, you know, uh, I could see where there would be frustration. The individual is put in a situation where she or he hasn't been trained
Yeah.
interpreter. So I guess how does one deal with that kind of thing? But also, how do interpreters who have been trained deal with that kind of thing, where they're saying rude things or things that could be taken, pretty harshly
Hmm.
by a medical professional?
Yeah. Well, the first part of your question, if you are a bilingual person and you're being asked to be put in that position of interpreting,
Yeah,
I think it's really important for you to know what your limits are. If it's a simple, this person's just checking in, I need to know if they have their insurance card, maybe that's easy peasy, right? You can ask a few questions you feel confident with.
yeah,
But if you're in a medical situation and you feel like you're not able to navigate, whether it's because of the terminology, because of the like social dynamics, if that puts you out of your depth, you really have the responsibility to say, this is actually beyond what I can do. Let's use the phone interpreter, get the video interpreter. There's always an option pretty much everywhere you go to have a professional interpreter on demand. So you have
Oh,
to kind of feel good
yeah.
in your professional boundary and saying, I'm actually not trained to do this. So let's find the person who is, because you don't want to be responsible for a medical error
Yeah,
or a delayed diagnosis, a misdiagnosis. We don't want harm to come to the patient.
right. And, as you were talking, what came up in my mind is that there are very sensitive issues. For instance, a doctor may want to give information about lack of treatment in a specific situation.
Hmm.
A person has had cancer, the treatment isn't working, so they have to talk about some really hard issues.
Yes,
So,
yes.
how does an interpreter handle that kind of sensitivity?
Hmm. Well, the first thing, kind of going back to the example of the patient who is using some maybe spicy language, being rude, um, guess what? They have the right to
They
communicate
have
with
the
their
right.
healthcare providers however they want. If they're upset and frustrated with their care, they have the right to express that and be heard. If
Yeah,
they're being abusive to the staff, don't you think the staff want to know that? If
yes.
they're like, F you, I'm gonna come beat you up later, like, isn't that information they need? See? Um,
I'd want to
so
know that information.
right, you would want to know that. And so really we're honoring their voice, their right to come in and have the conversation and the type of communication that they want. It does feel bad. It feels yucky to look at somebody that you respect and be like, I think you're a bad doctor. But as
Has that happened
interpreters,
to you, Emily?
oh yeah,
Oh,
people are upset, they're frustrated, a treatment didn't work, they were confused, and
yeah.
maybe they lash out. It doesn't happen a lot, but
No.
once in a while, and you
Right.
have to be prepared to sort of to like put that in a little bubble. It's not my words, it's not my thoughts, but I am
That's
honoring their
right. You
communication and
always come back
sending
to
it over.
boundaries, that
Yes.
ethical stance. Okay,
Hmm.
great.
And even when it is, a sensitive topic, a sad topic, we do have a way of, sort of focusing in on the communication in that moment. We have our feelings and we just like set them to the side a little bit. Maybe we stop looking at people's faces, we start looking at their shoes just to disconnect a little bit if it is very sad and you
Okay.
feel like crying,
Yeah,
because we want to
yeah,
like make sure they can have good communication in that hard moment. And then later we process our emotions. We talk with our professional peers. We make sure we don't ignore that feeling, but that comes a little bit later.
that that is a very good point because I can see how individuals who go into this field, they're service oriented. They want to assist, and so they're in general compassionate people.
Hmm.
And to be in situations, and I suppose there are situations where it triggers uh,
Hmm.
the interpreter's own experience
Yeah,
uh, before. So having that training ahead of time, what to do with that, what
right.
with
Yes.
those feelings.
So important. And there are some things that you might choose not to interpret for. Like if you're a person who's experienced a pregnancy
Oh,
loss,
oh
you
yes.
might say, you know what, I'm not going to go to the OBGYN clinic. Even though some appointments are happy and some are not, maybe that's just a place you don't accept appointments. As freelancers, we have a lot of ability to pick and choose
Oh,
where we
that's
go. So you can say, you know what, that's not for me. So that's definitely a choice that we can make to protect our hearts if we have been through like a hard situation like that.
yeah. I think that that goes for any medical professional, just
Hmm.
to know
Yeah,
what your triggers are and to take care of yourself as much as you can.
right.
Much as you
Hmm.
can. Well, great answers. I'm loving this. Um, so, can you give an example of one of your greatest personal challenges? I mean, just something that comes up off the top of your head, uh, just to give us a flavor of a situation maybe that you found yourself that was a surprise for you and
Mm,
to deal with.
yeah. I would say one set of challenges comes from the fact that there are a lot of untrained or kind of improvised interpreters out in the world. And so there's like, if you've had 10 interpreters, they might have approached things in 10 different ways.
Okay,
And
yeah.
a lot of times that includes a lot of things that, as like trained interpreters, we don't do, like giving somebody a ride, giving them personal advice, telling them, you know what, this doctor's not so great. I like this other
Oh
doctor
boy.
better, right? And,
Oh,
so people out, it's the Wild West sometimes with,
Yeah.
what people expect from their interpreters. And so if I come in and I have a few like boundaries, I'm going to help you with the communication. And I'm not going to tell you my personal opinion. You need help with this other thing. I can take you there and interpret for you, but I can't do it for you. Right. And so I have some boundaries, and that's hard because then they think, what's up with this lady? Does she not like brown people? Is she racist? Everybody else does it. Why is she so like,
Oh,
right?
yeah.
And so we have to like navigate that with the patients. Like, this is my professional boundary. I do it because this is what our professional rules say.
I love that example of the different approaches that, I mean, they're individuals, so they have their own unique personnel, medical interpreters,
Hmm.
so really communication, which my class is all about, it's important to really be clear about your boundaries. I think
Yes.
message I'm getting here.
Hmm.
Um, great. Let's see. Okay, we've talked about confidentiality, um, medical history. Um, what are the ethical boundaries for medical interpreters when a patient discloses sensitive or potentially harmful information?
Yes.
And I think most people in the medical professions are very aware that there are cases where you have to report.
Hmm.
Uh, do you have any thoughts on that or examples about
Yeah.
a situation that might come up like that?
Um, Certainly, we have a similar duty of care where if we learn about somebody's intent to self-harm, if we learn about an instance of child abuse or elder abuse, we do have a responsibility ethically within our profession, sometimes also legally, depending on what our like employment type is. It gets a little messy, but morally, we do have this professional responsibility to share that information. Usually that information then is shared to whoever is the main provider for that encounter. So to the doctor. I was in the waiting room and I witnessed this interaction between a mother and a child that worried me, and I want you to know about it. And then that doctor then can take that duty and report, if it needs to be reported or talked about, then it kind of rests with the doctor to do the next step.
Okay, okay.
Hmm.
Ooh, yeah, another complication. Uh,
Hmm.
how do you handle situations where a patient and provider seem to misunderstand each other despite accurate translation?
Yes.
Isn't that a
This
great
is
question?
It's a great question. And sometimes you're doing everything right. You're interpreting, you're nailing it. And still it's like they're talking about two different things. They're just going right past each other. So as interpreters, we have some professional roles that we take on. The main one is just, we call it like the message converter. Like it's from English to Spanish, Spanish to English, we just translate the message. But our next role, if needed, is being a clarifier or a cultural interface or a cultural clarifier. So
Oh,
sometimes there's a little bit of like hidden information, and it's really obvious to somebody, and it's not at all obvious to the other person. So why would I even say it?
normal
Like
with
it's
any communication, right?
Yes. For example, like, oh, my son was sick, and I gave him in Spanish un té, a tea. Now, if I hear that in English, I think, okay, like some Lipton, maybe a little like chamomile, right? Something in a tea bag that you buy from the grocery store. That's a tea. But for that patient, that might be an herbal tea. It might be a home remedy. It might have something that could interact with a medication that the child is being given. And so it's hidden inside that term, even though I correctly translated, they is tea. The doctor might not know the implication of that word,
Right,
right? So that
exactly.
might be a moment when we, as the interpreter, speak up in our own voice, interpreter speaking. Do we want to clarify what kind of tea? Just to like nudge the doctor. This is maybe an important question for you to
Oh,
ask,
good. Good.
right? And we say that also in Spanish. Le digo al doctor, la intérprete dice al doctor, que por qué no pregunta qué tipo de té. And that way they can then have the conversation and I can just go back to that message converter role.
Okay. Excellent.
Hmm.
Excellent. Um, yeah, you have shared a website with me, which has a lot of short videos about medical interpretation from Stanford Medicine. And I'm delighted with that and delighted to share it with my students. And one of the videos was reminiscent of what you're talking about, where the doctor needed to tell the patient about uh, unplugging the life support, which very, very difficult situation. And the patient or the family wanted, when the support was being withdrawn, they wanted something said about in the name of Jesus Christ. And the question was, well, maybe the medical staff doesn't really believe in that and we're might be uncomfortable with that. And so I think the medical interpreter talked to and they decided to have a chaplain come in at that time.
Hmm.
So sometimes you have to be creative, right, in the
Yeah.
communication uh, and be sensitive. I think that the more education medical interpreters or any of us get, the better it's going to be to
Yes.
understand these nuances.
Hmm.
So, is there anything else that what I really want is for my students to have practical information about communication. Is there anything that we haven't covered that you would like to share with them in terms of assisting them in maybe refining some of their skills when a medical interpreter is involved?
Yeah. I think the first thing to know is, like I mentioned before, interpreters are there to really represent all of the communication that goes on in the room. So if you're having, a chit chat over there with your colleague about something professional, something outside of work, that is information that the patient has a right to know. If they were spoke English, they would know exactly what you're talking about.
Oh,
So
yes, good
the
point.
interpreter may interpret that conversation. Um, and if you make a snide comment about the patient, like they have a right to that information as well. Because if you all spoke the same language, there would not be a question about them having access or not. It's
I
part of
hadn't
their
thought of
right.
that. I had not
Hmm.
thought of that. That is such a great point.
So really, just in the same way, if the patient is having a little side conversation with their spouse or a family member, you as a medical professional can know that information too. The patient needs to know that's not a private discussion while the interpreter is in the room, right?
Okay.
So it goes both ways. It's very like neutral,
Yes, as neutral as you can make it.
as neutral as we can make it. It applies to everybody, all the communication that goes on in the room. If there's an overhead page, guess what? We're going to interpret the overhead page because that's information the patient might need. If there's a shooter in the hospital, code silver, code red, like I'm
Right.
going to say that, right?
Yes.
Mm-hmm.
Yes. Well, this has been very helpful, Emily. Thank you so much.
It's
And
been delightful.
you're doing great work. I'm so excited again that we have such a program here and that you have come to this Zoom recording to share information with us. So thanks
Yes,
again.
my pleasure.
Bye-bye.